Hello, thank you so much for your time to receive my in-services. I'll be going over in this video Antibiotic Stewardship Program, and as well as what that is and what pertains to that. So the agenda for this will be an introduction to antibiotic stewardship, why it is important. We'll cover signs of a true infection versus colonization, proper indications of antibiotic use. We'll go over our goal focuses for this month, and then we'll finish it off with some key takeaways. So keep in mind that antibiotic refers to antimicrobials in this antibiotic stewardship, and that includes antifungals and antivirals as well. Antibiotic stewardship is a set of interventions created by the Johns Hopkins Hospital in 2001. In 2014, the CDC picked this program up in all healthcare facilities across the U.S. This means that there are no healthcare providers, CNAs and nurses included, who are not required to participate in these interventions. The reason the program has been widely spread is because of a huge uprise in everyday microbes that are developing resistance to our treatments and an increase in adverse events and outcomes to these antibiotics. So that included damage to organs, tissues, and effects to the long-term immunity. So why is antibiotic stewardship so important? We want to preserve effectiveness of these life-saving treatments, but they also kill off our good bacteria. So science consistently finds that this has long-term consequences to metabolic and insulin regulation, mental health, and it also impedes the immune system's capabilities. So a key takeaway here is regulatory bodies are requiring a minimum criteria to be met in order for treating providers to initiate use of antimicrobials. And this slide is showing the CDC's comparison of data from 2022 to the data from 2019. Because of the noted increase in adverse outcomes, they found urgent and serious rates of increasing antibiotic-resistant strains of microbes that are all around us, ready to infiltrate. They wouldn't have obtained this data without cultures, so we could improve this data by culturing more. And we as nurses are huge advocates for a safer use of a lot of pharmacologicals, so I highly encourage nurses to advocate for your patients. So if you notice here too that Candida strain is on here, take note of this as we see skin rashes so commonly in our population. Are those rashes really yeast? The critical role of documentation in antibiotic stewardship. With the lack in progress notes, there's no way to justify that you've followed your policy and the requirements given by your healthcare regulators. So there's no way to track trends to ensure isolation and prevention of spread of these highly contagious and deadly strains. And there's no way of noting that the infection is a true infection because someone who's able to document cannot come in a day or two after treatment starts to note what signs and symptoms were present prior to that treatment. So another key takeaway is a true infection is the presence of an infectious organism in or on the body that is also causing tissue damage or an immune response. Okay, so the presence alone does not indicate an infection. Okay. At every nurse's station is a pack of laminated reference sheets to guide you through the set of minimum criteria. There should also be one of these laminated on each cart, so you'll see this minimum criteria chart. It will be important to include the set of criteria that was met in your S-bar and in your documentation, as well as any vital signs. So what were those vital signs? So not just to note that the vital signs were off, but what were those vital signs? Here you'll see some key characteristics of a true infection are listed on the left. In the right corner, you'll see some examples of what criteria alone is not a true infection. Proper indication for antimicrobial use. So if you see an order with an indication listed as something like, an antifungal for redness or irritation or skin rash, this is not proper. an antibiotic ordered for a possible infection, not an actual confirmed infection, so not a proper indication. So keeping in mind that we did not use much of B-side, so an infection that might have began on this side would more likely have been acquired outside of our facility. But infections acquired by our residents while they were within their stay here, the trends for the month of May, they were skin and no culture obtained. So if you receive an order to begin an antibiotic without an order for culture, question this order. Our medical director is fully aware of the importance of the culture and asks that we place these under his name despite another provider that may not have ordered one. Especially in chronic wounds, we might hear the popular provider opinion that we will find everything. This is called polymicrobial results, and we might, but we cannot distinguish which of these have caused the infection. So which was over the 100,000 colony forming units that would indicate infectiousness. Ones below this count are not. So we cannot distinguish which antibiotics will be most effective and quick at targeting and destroying the infection without also creating more risk of the other microbes developing resistance. So the other reason is that we see cultures as a tool of precision and not guidance versus treating blindly. So not knowing what risk we are taking is sort of what we risk when we treat without culture. In the next 3 slides, we'll be going over our goal focuses for this month. For all staff, hand hygiene is going to be our focus. Remembering to always hand hygiene before touching your face, like when you're eating or adjusting your mask. And then there are 5 key moments for hand hygiene. So this is a fun trick. Before and after patient contact, before aseptic tasks, after exposure to any bodily fluids, even if you wore PPE, and after touching patient surroundings. Here is a demonstration of proper hand hygiene by the Minnesota Department of Health, which is a big infectious disease research program. So keep in mind the amount of time that you see taking place while she's applying friction to all surfaces of her hand. She's getting her fingernails. And just remembering to get those wrists as well. Okay, so on to skincare, and I wanted to start with a reminder that we all live with these microbes, and it's not until we provide them with the environment that they best replicate in that they're able to multiply enough to cause an infection. So remembering that it is the amount of colonies that we have that create an infection, not just their presence alone. So antifungals are not selective. This means they do not discriminate between host cells and human cells. So when we treat a rash that is not caused by a fungus, then we are simply risking more breakdown of the skin and risking resistance to any yeast that we live with every day. For CNA skill focus this month, I wanted to focus on skincare, keeping skin folds clean and dry, getting people out of bed, which does so much more than reducing pressure. We also promote circulation by sitting upright, which encourages venous return of blood and also encourages lung expansion for oxygenation. Our immune cells need their transportation. They need cellular energy. So blood flow and oxygen for cellular energy are important. Keeping residents hydrated, that's important. And then also just keeping in mind that majority of our immune system is our skin. So without that barrier, we lose most of our immunity. But then also our immune cells, we're highly affecting them if we're not giving our bodies really good homeostasis. For nurses this month, I want you to focus on culturing wounds, any drainage or sputum, anything that can be cultured. If a wound is not draining, it is still culturable. Cultures help avoid overuse and misuse of powerful antibiotics. It helps identify pathogens that might require isolation or additional precautions, so we can avoid the spread of these better. It helps track outbreaks or clusters in a facility. If we don't know, because we're not culturing, we would never know if we have outbreaks or clusters. Okay, and then also following minimum criteria. It's going to be a big focus. So some key takeaways are noted here. We want to know our facility microbiome. So what that means is the community of microorganisms, bacteria, fungi, viruses that are in our building among us. And some of us are spending 40 plus hours a week here. So, but it's also to keep in mind that if we see this microbiome in our community or in our facility, it's probably similar to the community around us, right? So we can see it change, and we can even see improvements based off our own practices if we know what our microbiome is. We cannot do this alone without teamwork. We can't develop this antibiotic stewardship program and combat our war against infectious microorganisms without a united front. And we are in a war against infectious organisms, and they are causing more destruction without readily available solutions than wars with weapons of mass destruction. So with that being said, effective antibiotic stewardship is our only defense to protect ourselves, our loved ones, and the generations that follow. If we continue our trend in the U.S., then the generations who follow us, even including the one that's just behind us, will see a world without life-saving treatments that we see as simple treatments today. Thank you so much for your time.